And welcome back. Dr. Mark Simpson with Simpson Dental Associates joins us now. And here's a number to call if you have a question about your dental health. 1-877-924-7888. And we were talking this morning with the other Dr. Simpson about occlusal disease. And you brought some graphics and pictures for us.
Graphics here, and basically what this is showing you is this is a normal tooth, and the layer on the outside is enamel. Well, what happens with people, sometimes if they've lost teeth or if they clench or grind their teeth at night, a lot of times, some people even do that during the day, it can wear the enamel off, and then you're down into the next layer called dentin, and that dentin is very soft. So once you wear through that hard outer layer, then you're down into those next layers. It can wear actually very quickly over just a matter of a few years. We've got some photographs here that'll show you this. If you look in your mouth and you see things like this, these are the lower front teeth on the left side of your screen, and you can see where the top of the tooth is worn off. That darker color is the dentin down underneath. And then these other two pictures are actually the biting surface of a tooth, of a back tooth, and you can see on the far right that crack that goes down the surface. So in other words, it thins out that enamel to the point that it can crack. So the problem is that as a dentist, if we're going to fix a tooth like this, we have to have enough tooth left to allow us to be able to fix it. And so if you allow it to wear too far down, sometimes the tooth is not savable. So if you're missing any teeth, you should be aware of that. If you're a clencher, grinder, if you have headaches, if you wake up in the morning, your jaws are tired, a lot of times these are signs and symptoms of occlusal disease.
How can you keep yourself from grinding teeth, even if you don't know you're doing it in your sleep? Any special guards you can place in your mouth?
Well, there are guards. The trouble I find, a lot of people try to buy those ones that you can get over the counter at a drugstore, and the problem with them is that they're generally rubbery, and so people have a tendency to grind on those and grind right through them. The proper type of a night guard is going to be either one that fits just in the front of your mouth and makes all the back teeth not touch, or one that contacts all the teeth, and I generally make those on the lower arch because they're more comfortable so that patients can sleep with them more easily.
If we can get one more shot of this photograph over here. Now the pink, that's the nerve, correct?
That's the nerve.
Can you ever grind down through the dentin and to the nerve?
You sure can. Absolutely.
Wow.
Absolutely.
All right, well, let's go to our first caller. Jesse is on the line. Hello, Jesse.
Hello?
How are you today?
Well, so.
How can we help you? How can we help you?
I was wondering if there's a place in Charleston that could help get dentures.
I do not know of any place other than HealthRight that can help you that way, and that's an income-based program, so you can call them and ask them that question, so they may be able to help you there.
And also, you know, they can go online, too, and find if there are any other alternatives. I know there's an outfit in Barbersville, too.
We do have a seminar coming up here soon actually in July, so just starting into this next month here. If you can get that graphic up, you can call our office at 304-342-6162, and that'll allow you the opportunity to get in on that seminar. It is free of charge, and if you go to our website, there's a lot of information there about teeth in a day and a lot of other information that people often have questions about.
And of course, implants are a good alternative to dentures for a lot of people, and it's very effective.
It is, and that's the main thing that the seminar is about. So if you're interested in that, give us a call. We'll be glad to help you.
Are you seeing a lot more patients coming getting implants?
We've had a banner year with implants. A lot of people that are in need of them, and a lot of people that want to look at all the different possibilities of how we can utilize implants to help them.
Makes a big difference, keeping that smile bright.
All right. We're looking for you to join our seminar, and there's the number on the screen.
All right, Dr. Simpson.
Thank you for your time today.
Thank you very much.
Appreciate it.
Well, stay tuned for a look at the top stories and also one more check of your forecast with Doug. We'll be right back.